Hi everybody, welcome back. This is going to be a quick, and I don't know how quick, look through what specialty training applications look like for doctors in the UK. Because let me tell you, I hate it. It's such a stressful process, and it's made more stressful by the system that you're working in. But so, as UK doctors, we are often complaining about the state of specialty training and all of the ridiculous hoops and trials and tribulations that you have to jump through to get anywhere near a whisper of a glimmer of a hope of simply continuing your medical career, particularly in a direction you want to move it in. But I thought the easiest way to kind of bring you guys on board and show you what it's like is actually just to show you what it's like and how you apply for specialty training or residency in the UK. So who's this video for? Medical students that might be thinking about specialty training in the next few years, IMGs, international medical graduates wanting to join a UK specialty training program. We all have to navigate the same process. So let's take a look at some examples together. I'm going to show you what it actually looks like on my own account. So today we're going to be talking about 3 different specialties: GP or general practice, family medicine, radiology, and neurosurgery. Just 3 slightly different specialties, but the specifics don't really matter. It's just about showing a range of the different types of processes you might have to go through, and each specialty does things slightly differently. Log on to this website, Oriel, the bane of my existence, but this is the system through which all specialty training program applications are done. It's a centralized process. So if you're applying for specialty training in the UK, you will be using this system. I actually made a video talking about applying for the academic foundation program and the foundation program a few years ago. It's, to be honest, a pretty similar process. So how do I find the jobs or specialties that are available? Well, you go onto vacancies like I have here, and I might search general practice. And once I've done that, we can see that there are several options available. The 3 that have shown up, the first one is GP National Recruitment Office GPST1, which is the one that we will use to apply for general practice. There is a dual track GP and public health, super competitive track. And then lastly, this is just an old advert for academic clinical fellow posts in GP, but that deadline, I believe, has passed. So let's apply for a GP job. So I've already started this, but this button would say like start application or something. So General Practice, National Recruitment Office, ST1, continue. So I'm going to blur out a lot of this, but this first page of evidence is just asking for all of your personal information. Make sure that you get this section right, and make sure that you are applying for training with the right to work in the UK. I know from speaking to several recruitment managers that people will sometimes apply for jobs when they don't have the right to work in the UK, and it is incredibly irritating for them because it gums up the system and they don't realise until some way in that sometimes people don't. So please be honest about that. So page 2 here, we have equality and diversity information. It just asks about a load of different demographic characteristics, and this is going to be common to all of the different training applications because they have to collect this data. And then it will ask about your full medical employment history. So important here, where experience is required, ticking this box will make you ineligible. So pay really close attention to what is required for what you are applying for. And then in this section here, employment history, what you have to basically enter is every single clinical or non-clinical job that you've worked. So if you are a UK medical graduate, this means putting in all of your foundation rotations one by one, and I can show you an example of what that looks like. And you would have to do that for every 4-month block. And then if you've done an F3, that forms another entry on this list, and essentially it populates this table that you can see at the bottom here with all of the different jobs you've worked in order by employer. And this is just checking that you have been appropriately employed, that you've not overspent in any time limits that are relevant for the specialty, and it highlights if there's any big gaps in your practice, basically, which you would need to explain if there are gaps of more than a month. Now this sometimes happens, it's not letting me move on. Yeah, see, this sometimes happens, it's not letting me move on because it's insisting that this that this table have something in it. So I'm just going to make something up, put something random in here so it'll let you move on. It's such an annoying feature of the form. But then we can move on to the next bit. So it's asking about our training history. Have you ever been released or removed from a UK training programme? Because obviously that's something they would want to look at. And do you hold a national training number in a different specialty? So you can change specialties. So if I was already in neurosurgery training, I could apply for this GP training number, and that's not necessarily a problem, but you have to have, I believe, a form from your current training program director, I think. Basically, it needs sign off from someone above you, and then it's just asking for some more personal details. Do you have full GMC registration? If you're applying for MaxFax, will you have dental registration? Identifies whether you're a UK medical graduate or not. Evidence of English language. So for most UK doctors, because your degree is taught in English, that is not something you'll bother with. Have you applied for an ACF in the same program? So if you apply for an ACF or an academic clinical fellow, you have to apply for the base specialty as well. So if I'm applying for an ACF in ENT, for example, I would also apply for core surgical training at the same time at my stage. And if you have a successful application from a previous recruitment round, are you able to transfer the scores, or do you want to? Not all specialties will offer this, but I believe that GP sometimes does. Then asking you just for references. So one of these needs to be your most up-to-date consultant or supervisor, and then it usually asks for 3, so going back 3 jobs. If this is for an academic program, it will ask for an academic reference as well. This is just a load of declarations about fitness to practice, which for 99% of people are all just going to be no, you've not done anything warranting investigation. This is, again, your primary medical qualification. It's wanting to know where you graduated from, the country in which you graduated, if you were doing MaxFax, your dental qualifications, just about previous competencies. Then this is where you have to do all your declarations and declare that you are going to meet what is expected of you in order to start the program. Basically, this is their big get out, where if you submit something that is false, that then becomes a probity issue because you are declaring that you believe all of this to be true. You're consenting that it can be used for research, and that you understand the requirements, and that you have done everything you believe correctly. Because if you make a mistake on this application form, often they will not let you do anything to correct it once the deadline has passed. So there is all of your declarations, and then for GP it asks for a driving license, or whether you have one or not, which I assume is for home visits. I'm able to provide emergency and domiciliary care, fair enough. What influenced your decision to choose GP? I guess that's just why are you doing this. I have no idea whether this is scored or not, but I assume it's not, given the volume of applicants. And then for GP, you are asked to rank jobs at time of application. So all the different locations and deaneries in which you would be willing or not willing to take up a job if you are offered one. GP is a 3-year training program, so the only option available to us is posts commencing from August 2025, which is when the next training round would start. They're all 36-month programs, and you can apply to work full-time equivalent, 48 hours a week, or less than full-time. This would be where all of your rankings were to go. So you can see all of the different locations that you could be willing to take up a post, and that is going to be a laborious task. And then finally, because the GP only uses the MSRA, the multi-specialty recruitment assessment, which is a primary care GP exam, it's validated for GP, so I don't object to that. That is it. That is how you submit your GP family medicine residency application, and I could confirm and submit. There's still things that I would need to fill out, but that is it. That is one specialty. It's probably the simplest one because everything is done based on your MSRA score, which is an exam that you would sit in January, several months from now. It's currently mid-November as I'm recording this, so I'm going to exit without saving, but for GP, that is it. So now let's look for our second one. We'll look for neurosurgery, just to show you a different example. So I'm going to search neurosurgery under vacancies. And again, the top of the list, neurosurgery, LAT1, ST1. What this HEYH thing, Yorkshire and the Humber, different recruitment offices will run national selection out of different places in the country. For neurosurgery, it's all run out of Yorkshire. Some places or some specialties will have this NRO or National Recruitment Office. For anaesthetics, it's called ANRO. For neurosurgery, this is the one you would be looking for. It's a 96-month program because it's 8 years of indicative training, and it's all ST1 entry. So we will continue because I've already started an application, and the different bits that I want to show you. So when we come on to supporting information, this is where it looks completely different to what we just looked at in GP. So evidence of selection criteria. In this case, you are actually going to be scored based on your portfolio. So in addition to your medical degree and foundation competencies and everything else, they want to know, do you have an undergraduate degree? So I, for example, have an extra Bachelor's of Science in Molecular Biology. You might have intercalated and it could go here. They want to know, have you done any undergraduate research or audit projects? And again, they want you to fill a table with, I believe, up to 5 different examples thereof, and they tell you what evidence they want to see. I'm just going to tick no because then it lets me move on. Have you achieved any undergraduate prizes and awards before your medical degree was awarded? So these are points essentially that are time locked to your undergraduate component before you graduated, so you can understand why so many med students are bothered about building their CV. It's because in situations like this would permanently lock off points that you would never be able to get. That said, don't be too worried because you can often score merits and distinctions and things in medical school. It's easier to get than you would think. Do you have a higher degree? So they specify 2 years of study, so that would be an MD at the minimum or a PhD at the maximum. Do you have a degree in medical sciences? Any other degrees and diplomas? So you might have your MRCS exams or a PG cert or a diploma or something. So I've got a PG cert in medical education, that could go here. Postgraduate research projects that you might have worked on that haven't led to a publication. So this is kind of things that you have worked on that have not necessarily led to all forms of output. So if you've done a project and presented it at a conference maybe, but it's not been published, then this is your place to talk about it. Have you won any prizes? Again, I think you can have up to 5 or 6. And these are ones that are awarded after your medical degree, so things that you can only do as a postgraduate. If you've got essay prizes, if you've got conference prizes, things like that, they can go there. Postgraduate clinical courses, so this is talking about courses that you have paid for realistically. Things like basic surgical skills, ATLS, CCRISP for surgeons, so care of the critically ill surgical patients. Any course like this that is relevant to the specialty for which you're applying. Do you have any teaching experience? That's often very highly valued in specialty. And would you like to receive recommended neurosurgery courses? So they do this thing called boot camp for new neurosurgery trainees, where you go and learn all of the basic skills. So you will obviously want to go and do that. Then there is another page. Do you have any peer-reviewed publications? Again, I think it gives you, up to 5 peer-reviewed publications that you consider to be of merit. Your level of contribution, the journal, volume, page numbers and year, impact factor. Do not list the patient authors, and they ask you what type of publication it is. So up to 5 papers. Any presentations, up to 5, can be poster, oral, national, international. Clinical audit and service improvement, you can have up to 3. Their organizational and leadership skills, practical and psychomotor skills. So how good are you with your hands? So if you have hobbies, for example, you might be into sewing or needlecraft, or you might paint miniatures. We know that loads of doctors play Warhammer, if anything, if the doctor's Reddit is anything to go by. You might be rock climbing, or you might do yoga or whatever. I'm a qualified eyelash technician. That's my fun fact. So things like that can go there. If you play a musical instrument, anything that demonstrates your psychomotor ability. Teaching, they want to know what you've been teaching and the frequency, and personal statements. So we've got 3 250-word white space questions, we call these. So free text, you can write whatever you want, talking specifically about the specialty. And obviously this needs to be very neurosurgery specific. They want to know why you're interested. And that also tells us that these are going to be read by a person, because otherwise there would be no point. So unlike GP, where allocating people to the specialty is not going to be done by a human, it's you do the entrance exam and then you will be allocated based on your score. This application has so much more in it that can be used to shortlist the best candidates. So for neurosurgery, they're able to do this because they're shortlisting from 300, 400 candidates down to about 60 that they'll interview. So it's a much smaller cohort than the thousands and thousands and thousands that will be applying to GP. Upwards of 10, 15,000 people will apply for GP. With neurosurgery, they don't do that. So they can look much more closely at people's applications. So that's neurosurgery. And then the last one, just to look at something a bit different, we're going to look at radiology, just as an example. So clinical radiology, specialty training, 60 months, that's right, it's a 5-year indicative training program, ST1 entry. So go to application summary, let's continue my application, and everything is under supporting information. So this is an example. Applicants are required to demonstrate you have 18 months or less experience in radiology to be eligible for the training program. So if you have more than that, say you are an IMG who's maybe been a radiology resident in your home country, you would not be eligible for this pathway. So they want you to specify and keep it under the time limit. Now they've got a self-assessment here, and they give you lots of guidance on how to score yourself. And you've got to confirm that you've read the guidance. So domain 1, commitment to specialty. How much significant exposure have you had to radiology? And it asks you to tick the appropriate one, okay? So one significant exposure might be a taste a week, as they've said. And if you've done a research project working with a radiologist, that would be 2. So you score yourself maximum points. And it tells you the evidence that you need for each one as well, which can be asked for at any time in the process. And then 100 words, white space question, how does this demonstrate your commitment to radiology? Leadership and management, again, a minimum of 6 months of a position in leadership, ideally that's relevant to radiology. I think that's so mean, because how many of those are there realistically? But it can be, not involving radiology, but leadership. So something like a BMA position or a society position or something at the national level. Teaching and training. Have you run a teaching program? Do you have a teaching qualification? So I've got a PG cert in med ed, so that would score me this one, for example. Audit and quality improvement. Have you changed practice? I think I've done one of these. I did an IR audit. And then academic achievements. So I have a PhD. I have a radiology paper. I think I've got this one. I've got a radiology paper. Oh no, I'm lower down, not as a first author. But you've just got to basically look through the evidence and find which one is relevant to you, and do you have any relevant prizes. And again, make sure that you've got the evidence available for all of these, because if you're asked for it and you don't have it and you declared that you want those points, then that might be a problem. And for all of them, or for most of them, it's asking you to elaborate a little bit on why it's going to make you a better radiologist. And that's it. So the last thing that I want to show you, just because it's maybe the most stressful part of the application. So these are programs to which I've already applied. So this, for example, is an ACF in neurosurgery. So standard applications haven't gone in yet, but academic clinical fellowship posts work exactly the same way. And while you've got an active application, you can see this timeline, this checklist of where you are. So you've applied on time, you've been longlisted, So that's getting through the eligibility checks. Then you will be shortlisted to interview, which is the process for these that's happening right now. And if I show you my neurosurgery one, as brutal as it is to be reminded of this, you apply, you are longlisted, you are then shortlisted, you get your interview, and then you get your rank after the interview. At least this is for neurosurgery how it works. I don't know what other specialties do. And then if you received an offer, if you will be shown it here, which I obviously did not. But that, guys, is just to show you what applying for specialty training is like, how your portfolio feeds into all of this, and why we talk about it, and why people are so bothered about being competitive, etc., 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 and what it's really like and what it looks like on the other side from the perspective of someone that's going through it. It's a really difficult time, super stressful. This is now my second time going through it, but as ever, we need to be real with one another. We can work together as a community to make sure we try and get through it, because it sucks. It really sucks. But wish me luck, please. I wish you luck. And if anyone is super stressed or wants to talk about it, just email me, get in touch, and let's all whinge in the comments together about how much it sucks, because it does. But I hope that's been helpful. Take care, and I'll see you soon.